In this video, I'll be talking about the clear-cut concepts of impotency, impotence, and sterility. So now, first let us understand the first line written in our notes. It's written that impotence or impotency, it is inability to perform intercourse, right? It can be because of insufficient erectile dysfunction, right? So that can lead to a failure in intercourse. Inability to perform intercourse is impotence. How do you remember? I is impotence, I is intercourse. So inability to perform intercourse. So next thing you have to understand is sterility, right? What is sterility? Sterility is inability to perform or get children's, like inability to get children. So it might be because of any infection which is happening in the uterus, or it may be in the male conditions, right? So now in this session we'll be dealing about the important point of view. The first is impotence, and remember that this impotence, it's a ground for divorce, right? It's a ground for divorce. So this is what you have to understand that. And you got something in the female also, as we have in the male, you have in the female also, that is known as female impotency. And this female impotency is known as frigidity, right? And you have to understand that this frigidity, if you look at the frigidity here is, right, what is that frigidity? Frigidity is failure of a female, right? I'm telling the meaning of frigidity. Frigidity is failure of a female to respond to sexual stimulus, right? She fails to achieve the orgasm, right? So she fails to respond to sexual stimulus. So that's what the frigidity means. So it can be because of imperforate hymen, and it can be because of vaginismus. I'll be dealing about the hymen in detail in the coming, but right now we just understand the meaning of vaginismus. So what does it mean here? See, you can see that in these, the adductors, right, the adductors of thigh, the interior aspect of the muscles, the adductors of thigh, they go in spasmodic contraction, right, on attempting sexual intercourse. When a person try to have a sexual intercourse, these adductor muscles, they try to contract, they try to go in a spasmodic contraction, right, so that the person cannot have a sexual intercourse there, because those muscles are contracting. We have got a spasmodic contraction of those adductors. So you got a muscle known as gracialis that also plays a vital role, important role in adducting the thigh. So it is also known as anti-rape man, because it is getting closer, right? It is getting the legs closer, so the man cannot rape. So because of the muscle, and this muscle is known as anti-rape man, right? So this is all you have to understand regarding this vaginismus. As I told you, impotency is a ground for divorce, but sterility is not a ground for divorce. You can give the divorce if he is impotence, but sterility is not a ground for divorce, right? And the most common, right, the most common impotence, that means you have got something known as the most common cause of impotence is, vasculogenic, right? It can be vasculogenics. And the most common temporary impotence, it's because of fear, psychological, right? And next you have got something known as quad hen, right? What is quad hen? What is that? It is a selective impotence. A person is impotent to one female but not to others, right? As an example, you can just take the example, he is impotent to wife but not to other girls, right? So that is what the quad hands means. So that's all you have to understand regarding this. And the next thing you have to understand here is, you should know a few things. That is, in the female, right? In the female, we have got few words to understand the meanings, right? So let us go with the first meaning, that is virgin. A virgin in the sense no sexual intercourse, right? And you have got a something known as defloration, right? What is defloration? A defloration is nothing but it is a loss of virginity. A loss of virginity, that is, a loss of virginity is known as defloration, right? And the most important sign is dilatation of vagina. You can see there is a dilatation of vagina, and that is the most important sign for the defloration. And next we have got something known as false virgin. False virgin in the sense she's not virgin, right? And you have to understand the meaning of false virgin is she but the hymen is intact. You should know the meaning of hymen here. So you can just see this, right? You can see the interior aspect here of the female reproductive. So you can see this is labia minora. You can see labia majora, right? And you can see the opening of urethra here, right? You can see this is an vaginal opening. And if you observe this structure here, and this is what the hymen means, right? This is what the hymen. So simply, hymen is an mucosal fold. This is a mucosal fold. You got a clitoris here, right? So this is what you have to understand here. Though she had a sexual intercourse, there is no rupture of this hymen. And this is what the false virgin means. I've told you that the hymen is a mucosal fold that is not ruptured. And remember that hymen is not ruptured if she runs, jumps, or dances. But the hymen ruptures when she masturbates, or the sexual intercourse, or the trauma, or sanitary tampon. So, what do you mean by sanitary tamponade? Actually, the meaning of tamponade in the French, it means piece of cloth which stops the hole. Okay, so what happens in this, they use for the stopping of this menstrual blood. That also when they put it in the area, and that can tear the hymen. And next thing you have to understand regarding this sola pith, that is a plant form. So what is this? This sola is it is derived, it is a milky white spongy plant. If you observe this, so this is how the sola pith looks like. So it is derived, it is a milky white, a spongy plant which can be pressed and shaped into a different object. So this is a milky way, it can be shaped in different objects, right? So what do they do with this? So what do they do is they put it in vagina, right? So suppose if the whole of this aspect like hymen of the vaginal opening is which is small, what they do, they fit in that. So this solar pith has got an hygroscopic, right? It absorbs the water. So once it absorbs the water, that swells. Once that plant swells, even it dilates the vagina, right? When it dilates the vagina, it ruptures the hymen. It ruptures the hymen. So this is what you have to understand the concepts of this solar pith. And next you have got something known as hymen is torn in the following intercourse. Once she had an intercourse, the hymen can be torn in the different places. So the hymen mostly, in the most common, the hymen tears at the posterior lateral aspect. It can tear at 5 o'clock or 7 o'clock position, or it may tear at 4 o'clock, 8 o'clock position, and it may tear at the midline at 6 o'clock position also. That the most common, it tears at the posterior lateral, right? So at you got on 5 o'clock 7 o'clock position, right? 7 o'clock 5 o'clock 7 o'clock position is the most common tear seen. So it can be because of masturbation fingering, right? So that's all you have to understand. And now we have got something to examine, actually to examine the degree of rupture of hymen, whether the rupture is recent or old. We got some rod known as, what is this, Glacian, right? 1 minute. What is that? It is Gleister keen rod. What is this Gleister keen rod? It is a dumbbell shape. It looks somewhat like this, right? So that it absorbs it tells us the degree of rupture. We can look into it, degree of rupture, like whether the rupture is recent or old. So we have put it in the lithodermic position. Then we are gonna put this in the vagina, and we're gonna look at the intercourse. Right? So not intercourse, this hymen. So that's all you have to understand. And the other things you have to understand here is, you got a most common type of hymen is crescentic or semilunar. So let's see what is that actually. I have already told you the interior structure of lumen. You can see this is the lumen, and this is what this semi or semi lunar or crescentic lumen is. and you have got some other time which resemble, you have got something known as fimbriated hymen. This is how the fimbriated hymen looks. You can see fimbria, you can see the finger like projections, and this resembles the torn hymen. This resembles the torn hymen. So whenever you look, you might be thinking she had an intercourse, so it resembles the torn hymen. So this is all you have to understand here, right? And next thing you have to understand is carunculae multiformis. What does it mean? This carunculae multiformis, they are the small elevated of mucous membrane around the vaginal opening. Say example, this is a vaginal opening, and you can see the small mucosal folds, and these mucosal folds are the remnants of hymen, and this is what the carunculae multiformis means, right? So let us end the session by speaking about small things regarding the artificial insemination. What is artificial insemination? The medical procedure where you inject the semen in the female reproductive part, says uterus, right? So this is all you have to understand regarding the artificial insemination. We'll be dealing in gynecology wherever it comes, but the thing you have to understand here is maximum 10 children's they can have in artificial insemination. So that's all regarding this impotence and the sterility. In the next session we'll be dealing with some other topic. Thank you.